Actress Ricki Lake is showing off her new look. Dr. Chaffoo is here to break it down and all the work that she does. You know what she had done? Can you tell?
It's hard to tell exactly. I mean, but what happened, I think, for her was that she had a significant weight loss, Shali, and so we've seen this thing called Ozempic face, where the face just tends to sag for several reasons. One is because the skin has been stretched out, and when you lose that weight, the skin sags more, obviously, as we age, and also we lose volume in our face. We lose the fat in our face. So probably a combination of what we would call a facelift or deep plane facelift with some fat transfer. That's a very common combined procedure.
It's amazing that we're talking about her today, because I don't know what it was last night. She was popping up all over my feed. She's been through a lot. You talk about this weight loss. I mean, what did she lose? Like almost 40 pounds?
40 pounds, which is a significant amount of weight to lose. Obviously, when you're very young and lose that kind of weight, the skin has got better elasticity, but when we've lost that skin, and you get more sagging as we age because the skin tone just doesn't snap back as easily.
Is the procedure, is this her after? Is that what we're recent?
That looks like a more recent photograph.
Oh, she looks stunning.
She looks really good.
She looks really good. So is this procedure a common procedure?
It's a very common procedure. I mean, it's something that I do very frequently. And there are older techniques of facelifts. Years ago, Charlotte, it used to be just operating on the skin, where the skin was pulled very, very tight, and you would get this windswept appearance of the face. Now, what we do as plastic surgeons, we operate under the skin, so it's that deeper tissue, the loss of the muscle, and we can tighten the jawline, the neckline, raise the cheek tissue, and then when we're taking skin out, we're taking less skin out, so we're essentially creating almost a scarless look. It's very, very hard to see the incisions. The old technique was when we were really pulling hard and pulling very hard on the incision line, but now we're working on the tissue underneath. Then we're going to add fat to the areas, sometimes with loss of or hollowing in the temples, the cheeks, around the mouth, the lip areas, and that enhances the results for this procedure.
You have a few before and after pictures of
I do,
patient?
and this is a good example.
Oh, wow.
A beautiful lady here, and you can see this is just a front view. The side view really shows that neck, the jawline. And again, what you're trying to create is a very natural look. You don't want to make somebody look artificial or stretched, but again, you really want to pick up that jaw, that neckline. You want to return volume to the face, and you want to turn that clock back like 10 to 15 years. So you still want to be yourself, but just a more youthful version of yourself. And I think that's what patients are most concerned about when they come to see me. Is, well, I don't want to look different, but I want to look more youthful. And now with this deeper plane technique that I use frequently, actually it's pretty much the exclusive way I do it, we can restore that facial tissue to the way it looked beforehand, and the little scars are really imperceptible. We don't move hairlines at all, so it's a really natural look for a patient.
It sounds like this is a big surgery to have, so is there a big recovery afterwards?
So the most important thing is make sure you're seeing a surgeon certified by the American Board of Plastic Surgery. You want this done in a surgery center with a board-certified anesthesiologist, obviously. And then recovery is usually about a week or 10 days. I mean, there'll be some swelling, some bruising, but the anesthetic techniques as well as the surgical techniques have got much more sophisticated. So oftentimes my patients will be back to activities within a couple of weeks.
Are there any procedures, regardless of your age, 20, 30, 40, 50, 60, that would work for everybody?
There are. I mean, one of the first things that people will oftentimes do is they'll do fillers, Botox, because that's the first, foray into that area. Then after that, smaller procedures, maybe just a neck lift, which we can do from just underneath the chin area, or isolated fat transfers if we're just beginning to lose volume. So it really depends upon looking at the patient and seeing what's going on anatomically. It's not so much an age issue, it's a physiological issue. Is the skin got a problem? Is there a lot of lines or wrinkles or aging? Do you need laser resurfacing? So when a patient comes in, you really need to look at them three-dimensionally and figure out what they have, and most importantly, what bothers them.
Yeah, what bothers them. Dr. Chaffoo, thank you for being here.
Sure, good to be here.